close the door behind me. Hey, my name is Madison. I'm a Bevel State nursing student, and I'm going to be giving you some shots today. I have 3 shots. I'll be giving your insulin. I'll be doing a TB skin test, which just makes sure that you're negative for tuberculosis, and then I'll be doing an antibiotic. Could you state your full name and date of birth? Okay, check the bracelet. And before we give the shots, I'm going to show you just some sites, landmarks of the injections. So, usually with the intramuscular shot, there's 3 places. There's the deltoid, which is, how you find it is you find your acromion process and you place 4 finger widths down, and usually there's a triangle, and then right in the center, that's the injection site. And usually you always want to come with the needle at a 90-degree angle, so it's just straight through. So if I were to give this injection, still has a cap on it, it would be straight through a 90-degree angle. Okay. And then for the ventrogluteal site, so the patient would lay down on their side, right or left, and they would bend the knee, and the bottom leg would be at slight more upper than the bent leg. And so the bent leg, this is my bent leg. You're going to place your hand, you're going to find the greater trochanter, and you're going to place your whatever side they're laying on. So if they're laying on their left side, I would use my left hand, and I would place it on the greater trochanter and have my thumb facing toward their groin, and then my index finger and my middle finger, I would make a V, and in between, I find my knuckles of my 2 fingers, and in between those 2 fingers at my knuckles would be the injection site. So I have that there, and I found my injection site, and same as my deltoid, I would go, still has a cap on, I would go in with that at a 90-degree angle. And then my other site is my vastus lateralis injection site, which is, again, this is my leg. So they can be laying down or sitting up. You would, either leg, you would find the greater trochanter, which this is it, and then your hand, place the hand right above your knee, and the injection site is going to be on the anterior part of the leg, the midline lateral part of the leg, or midline, and in between those parts, about a third of those between the midline and between the greater trochanter and the above the knee, in between that on the outer aspect of the thigh would be your injection site. So it would be right about here. Again, have my cap on. You would come in and with a 90-degree angle. Okay? And then, I'm just gonna use this now. And then, so I have my, my insulin, so my sub-Q shot. So there is a couple more landmark sites for your sub-Q. There's your abdomen, which is usually anywhere above the umbilicus place. It's 1 inch above, so anywhere around here. And then that outer aspects of your back, and then your thighs, the anterior parts of your thighs. And then we have your arms. So your arms, it's not going to be in the front and it's not going to be the back. It's going to be kind of the outer part of your arms where this fat is. And when you grab it, you're not going to be grabbing the muscle, you're going to be grabbing the fat. So it's like right about here, right there. And then we have another spot, which is the upper back. It's right here. And then, let's see. Those are all for the sub-Q. Okay, intradermal. Well, for my angle for my sub-Q, so depending on the person, if I can pinch more than 2 inches of fat, I'm going to come in at a 90-degree angle. So example, I'm going to pinch. You don't want to pinch up the muscle, you want to make sure it's just the fat. So if it's more than 2 inches, you're going to come in at a 90-degree angle, and if it's less than 2 inches, you're just going to leave it, and you're going to come in at a 45-degree angle. So not straight, but it's going to be more like this, at a 45-degree angle. And then there's my intradermal landmark sites. So for those, you can do your forearm, which is 3 finger widths from my wrist, so probably about right here. And then you can do it on your chest, like your upper chest right here. And then you can do it your upper back, your scapula area. So for that, it would be a 5 to 15 degree angle that you would be doing your intradermal injection sites. So it would be, you would have it kind of like that, going in, capsule on. And okay. Before I administer my medicine, I'm going to do hand hygiene. And I'm going to check the 6 rots of my medication. Make sure it's the right drug. Right drugs, or no, the right client for my, make sure it's the right patient, then the right drug, have all 3 drugs, the right dose, make sure I'm giving it the right route, and it's the right time, and then I'm going to document it. Okay? And so I'm going to start with my my TB. I'm going to put gloves on. So like I said, TB is an indicator to make sure that you're negative of tuberculosis. And you usually give the shot, and then you usually see if it doesn't react within 5 minutes of giving the shot, and then they come back about 48 hours later to read the test. So going to I'm going to clean my sock. And again, I have checked my 6 rights to make sure this is the right drug, right client, right dose, the right time and right route. So take that off, and we're going to make sure the bevel is up, and then we're going to come in at a 5 to 15 degree angle. Okay, and then okay, and then all right. And what I did too, also, you have to before removing it, leave it in there about 10 seconds before removing the shot. And so now I'm going to dispose of my shot in a sharps container. And now, next, I'm going to do my insulin. My sub-Q, which is, I'm going to clean the area, and I'm going to do this I did my TB in the forearm. Now I'm going to do my sub-Q in the abdomen. I'm going to clean it first. You want to clean the area that you're going to do it, and then clean around the area too. About 1 to 2 inches around. So abdomen, like I said, you would pinch up 2 inches, and if it's 2 inches, you're going to go in at a 90-degree angle. If I can't pinch 2 inches, then I would just do it at a 45-degree angle. So we're going to remove my cap, pinch up. Patient seems like we can pinch up 2 inches. So we're going to go in at a 90-degree angle. And we're going to then we're going to leave it in there 10 seconds before removing it. Okay. And then before removing my 2 fingers, my thumb and my index finger, I'm going to hold it 3 to 5 seconds before letting go. Okay. Then I'm going to dispose of my syringe and my sharps container. Okay. Next, I'm going to do my intramuscular injection. So this one's a little different as far as you're going to aspirate, which is when you stick the injection in, I'm going to pull it up a little bit just to make sure I didn't hit a blood vessel. There's no blood. And if I have not, then I'll just move forward with my injection. So we're going to clean the sock, clean the area. And I'm doing it my ventrogluteal area, so it's greater trochanter. And the patient's laying on their side, so that clean the area and around it. Okay. So, and with this one, it would be at a 90-degree angle. I'm going to remove my cap. You're going to go in at a 90-degree angle. And you're just going to come up a little to see if you're going to aspirate. You're going to make sure you haven't hit a blood vessel. So it looks good. So now we're going to move forward and inject it. And so you're going to wait 10 seconds before removing it. Okay. And then I'm going to put into my sharp container. And I'm going to take my gloves off and do hand hygiene. I'll remind the patient that if they need anything, if they feel any pain, discomfort, to let me know. And then I will exit the room and document.